The pain was diminishing gradually. I noticed that when someone mentioned the word disc in a conversation, my pain increased. I had to reread your book several times to keep my confidence going, and after each reading, my pain lessened. I avoided contact with my orthopedist and people who believed that they have structural back problems because I was too tentative in my new understanding. And the cycle of fear, pain was readily reactivated by thinking that you might be wrong. When I began to recover, I saw a physical therapist who thought that your ideas were plausible and helped me to increase my range of motion and rebuild my muscle strength. In retrospect, she was most helpful in making me feel safe about moving again. During the past year, I have been unrestricted in my physical activities. I have done many things which should have been terrible for a herniated L4, L5, and sciatic pain, such as fly to Thailand 26 hours of an airplane sitting, build a room in a basement, ski, hike, lift babies, and hike with my backpack. I rarely feel sciatic nerve pain, and when I do, it is mild. I no longer think about my back. Instead, I think about what may be making me feel anxious or tense. I experience my sciatic nerve as a benign barometer of anxiety. I know that you have heard many stories such as mine. I hope this letter can be of use to others who are suffering from what, for me, what was an iatrogenic disorder caused by my orthopedist's misunderstanding of what began as a harmless somatization problem. Dear Dr. Sarno, I am delighted to offer my comments concerning your book and its effects on me. In the summer of 1987, while playing tennis, I suffered a sudden incapacitating event in my back. I had some minor back problems as a teenager, but had been a symptom free for over 20 years. I am 41 years old now after I managed to get to work, but my boss, who had and still has back problems, which eventually led to surgery, saw me. He ordered me home to a doctor immediately. At the doctor's office, the orthopedist lugged out a model of a spinal column showing me how nerves can get wedged between bone and cartilage and create the terrible spasm I was experiencing. His advice was to get into bed for 2 weeks and certainly not to go on the week-long bicycle trip I had planned for 10 days. Hence, I immediately broke out into a cold sweat over the prospect of missing 2 weeks of work and apparent seriousness of my malady based on that long convalescence. Well, I actually stayed in bed for 5 days and then returned to work, still in pain, unable to sit for extended periods of time. I spent a few hours a day on the floor in my office with the telephone by my side, then armed with Motrin and Robaxin. The doctor described, I think it's prescribed. I went on the bike trip. Strangely, I actually found that my back was feeling better a week more on, despite the fact that I was propped up on a bicycle seat for 5 hours a day. Aha, clue number one. For the next 10 months, I had a few other less severe incidents. Each time I had one of these occurrences, I put away my running shoes and tennis gear and waited for the pain to subside, all the while visualizing my spinal cord was being sawed in half by disc pressing on the vertebrae. In the spring of 1988, coincident with a particularly stressful situation in my life, I had suffered an attack that persisted for weeks. At about the same time, a friend who had chronic back pain problems for years, told me about you. It was dubious, to say the least. I guess you could say that the 2 round trip commutes to New York that it took me to read the book changed my life. It's embarrassing to think, this is the one that did it to me. Embarrassing to think that I am so typical, but on another hand, maybe not. It was reassuring to learn how normal I am. The book would made perfectly clear to me that although the back spasms were indeed real, they were a function of muscles deprived of sufficient blood flow. While I feel society may have unrealistic and unfair expectations about the power of self-healing, such as attaching implicit blame on cancer victims for their inability to conquer their disease, I now absolutely convinced that so much of our well-being is within the grasp of each of us. Your book has simply showed me the direction to go when the problem arises. Dear Dr. Sarno, your book was literally a relief. The attached letter to my doctor perhaps best sums up my situation. I hope my written gratitude accurately reflects the relief your book has given me and my wife. Thank you. Dear Doctor, I am writing to you to tell you how I progressed since I last saw you in November. When we last spoke, you had reviewed the results of an MRI I had taken. At that time, I was close to acquiescing to your recommendation for surgery. I had not improved after extended bed rest, and subsequently an MRI appeared to show a herniated disc. After I saw you, and I tried a chiropractor, but he was no help. The pain in my leg would get better at times and worse at others. There was no definitive patterns. Then Christmas time, I canceled all vacation plans and decided to spend 3 weeks on my back. But after 1 week, I was in more pain than ever. Frankly, I was terribly worried. I had almost resigned myself to adjusting to a restricted lifestyle, that is, until a family member sent me a book on back pain, which I feel you should know about. The book, this is to his doctor. The book was spectacular because it attributed my back pain, after thorough description of the pain and likeness, to muscle spasms brought on by tension. The cure: to get out of the bed and resume life as normal. Get the blood circulating to cramped muscles and relax. We'll continue.